obliged and came up with this lecture. So, most people find this lecture informative. I think most of the discussion will come at the end of the lecture. The last few slides, I think, is going to generate, as it always does, a lot of questions and comments. So we will have we'll have some time afterwards for questions and comments, because I think the last few slides are to generate a lot of questions, okay? All right, so HIV and nutrition and why it's important. So we're going to talk about, in this lecture, we're going to talk about some of the risk factors that lead to malnutrition in children who get HIV and AIDS. And some of the nutritional deficiencies that people get. So what if they're not taking a particular vitamin or nutrient? What can happen to them? And then talk about some of the intervention strategies that we can use for people who are having different problems. Okay? So why is nutrition important? Well, I think this slide emphasizes why nutrition is so important. So this was the major causes of death among children worldwide in the year 2000. So it's 10 years later, but the changes really haven't changed. The percentages haven't changed very much. So you can see that pneumonia causes a lot of death in children. Diarrhea causes a significant amount of death in children. Malaria, not so much in South Africa, but there are some cases of malaria, particularly in northern South Africa. Measles, we still see. HIV/AIDS, accounting for some. Okay, perinatal deaths, so early deaths within the first few weeks of life, account for a very large percentage of deaths, and then everything else makes up about 30%. Well, if you look at these different things, does nutrition impact whether a person will live or die if they have HIV? Absolutely. Does nutrition contribute to people who die with the measles? Yes. Children with vitamin A deficiency have a higher risk of dying of measles. What about malaria? Children with iron deficiency anemia have a higher risk of dying with malaria. What about diarrhea? Malnourished children, one of the common reasons they die is diarrhea. What about pneumonia? Yes, malnourished children, another common reason they die is pneumonia. So about 60% of deaths in children are associated with undernutrition. So it's a very, very significant contributor to early childhood deaths. Okay? If we improve the nutrition of children, we could diminish lots of the deaths in that 60% portion. So that's why it's important. But it's a vicious cycle. Once you're HIV infected, your CD4 starts to drop. You get immune suppressed. You get immune suppressed, that leads to infections. Infections increase your metabolic rate, which require you to have more nutrition, more calories. But it also leads to malabsorption. You're not absorbing the food and the nutrients as well, which leads to malnutrition. Malnutrition worsens the immune system. And so it's a vicious cycle. Once you're HIV infected, this vicious cycle starts, which leads to immune suppression, infections, not absorbing things, malnutrition, which makes the immune system worse. And it just goes round and round and round and round. Which is why most people with HIV, the first symptom that they get is weight loss. Right here explains why. So you have increased energy needs because of this immune suppression, because you're not absorbing things as well. Plus, the way I like to think of it is HIV takes over the body's machinery. Remember, the HIV virus goes in the body, and its one job, its one thing it wants to do is make more of itself. But it does so by taking over the body's machinery. To make more HIV requires energy. Whose energy does it use? Well, it doesn't use its own energy. It uses the person who's infected's energy. So that takes calories, that takes energy for the virus to make more of itself, and it doesn't use its own energy. It uses energy from the person that it's infected. So to make all those billions of viruses that float around inside the body is already taking up some of your energy also. So that's another reason why you need more calories and more nutrition. So it's estimated that you need about 110% of usual caloric needs to maintain your weight if you're HIV infected. Because the virus is making more of itself, it's stealing your mechanisms and it's using up some of your energy. Plus the recurrent infections, plus the malabsorption. All of these things. But when you're sick, it can actually increase by 150% of the usual calories. Particularly when you have particular opportunistic infections, it increases your metabolic rate. You're burning more calories. If you have a fever, for every degree of fever, that increases your energy needs by 12%. If you're having recurrent fevers, you're burning more calories. You need more. And oftentimes when you're sick, most of the time when you're sick, your appetite isn't very good. So although you're burning more calories, you're burning more kilojoules, you're not taking in all that you need. You may need to be taking in 150% of what you normally take, but you might only be eating 50% of what you normally take. So you're burning energy and losing weight, and that's a risk for malnutrition. So what about some of the GI manifestations? When we talked about what are some of the manifestations, one of the first answers was diarrhea. Well, diarrhea leads to up to 25% increase in the energy needs in a child. And of course, when you're having diarrhea, when you're having a running stomach, you're not absorbing things as well as you should. So that also can lead to malabsorption. As we talked about last lecture, some of the stage 2 things, oral sores, thrush, stage 3, esophageal candidiasis, stage 4, all things that would make it painful to eat. So you may not want to eat, but you're taking in less calories. Of course, nausea and vomiting increases the amount of nutrition that you lose, and it also decreases the amount that you want to take in. And then there's malabsorption associated with the HIV. There are also other risk factors like developmental problems and psychosocial issues. Often children who are infected with HIV have delayed milestones or developmentally delayed, and they may often have feeding problems. They often have swallowing problems similar to children who have cerebral palsy. And of course, there's neurologic deterioration as they get sicker and sicker and sicker. What there might also be, and this is not uncommon, is financial problems. There might be too many children in the house to feed. Nobody's working, so there's not enough food to put on the table. That leads to malnutrition. Okay? And what if the caretaker is depressed? This is something we commonly see. I see lots of go-go's who their children have died. They're old. But yet they have to take over the care of their grandchildren. They have to act as the mothers to the grandchildren because their children have died of HIV. They tell me, but Brian, I'm too old to be caring for these children. I'm not working. How am I going to feed all these kids? And often maybe 1 or 2 of their children died. So they have to take care of 4, 5, 6 grandchildren. It becomes difficult to feed all those children, difficult to take care of them, and oftentimes they become depressed. It's hard for them to prepare the meals, to put enough food on the table. So what about growth? Well, as we said in the first lecture, Dr. France mentioned, checking on the child's growth is one of the most important things we do as we're checking on children, HIV positive or negative. If they're doing well and growing well, that means most things are working. So we need to check on their height and their weight, and that gives insight as to the child's disease progression. If they're gaining weight well, they're gaining height well, chances are they're pretty healthy. In HIV-infected children, poor height growth velocity, so they grow slowly, and low height for age, which is called stunting, is associated with poor prognosis. Okay? And of course, HIV wasting syndrome is an AIDS-defining illness. It's stage 4, so adults or children would qualify for ARVs simply because of wasting syndrome. So how do we do a nutritional assessment? What is involved? Well, it should of course involve weight gain, linear growth, and the FOC, which is the frontal occipital circumference, measuring the head circumference of a child. Okay? And it's not just a one-time weight measurement, not just a one-time height measurement. It should be ongoing at every visit, and then you can plot them on a graph, which I'll show you. This will indicate whether they're growing well or having growth failure. We can also do a biochemical assessment. And these are lab tests. You simply draw their blood, and there are certain lab tests which help you know whether the child is well nourished or might be malnourished. And then take a diet and feeding history. What is the child eating? What meals are they eating? What do they get meals at school? Okay. If it's a small child, are they breastfeeding? Are they formula feeding? Are they mixed feeding? What are they taking in? So in small children, less than 2 years of age, it's important to measure their FOC, their frontal occipital circumference. And so this tells you how well the brain is growing. If the brain is growing well, that's a good sign. If it's not, that's a very bad sign. So we measure the frontal, which is, and it's a difficult thing to measure because you have to know exactly where to measure in order to track it right. So the best way to measure it is the frontal, which is the most prominent part of the forehead, and the occipital point, which is the most prominent point. You can usually feel a nice little lump in the back of your head, and that's what you should feel for, and that's the frontal occipital circumference. You match the measuring tape up with the point that sticks out up here with the point that sticks out back there, and wrap it around, and that's the frontal occipital circumference. And of course, you go behind the ears, not over top of the ears, because that's going to mess up your measurement. Okay. So there are many different charts out there. There's the CDC charts from the United States, the Road to Health chart, that the patient carried medical record, that most, if not all, children in South Africa has one. The WHO has their own. There's all different growth charts. I'm going to show you the CDC ones. You could use whatever one you like. It doesn't really matter. The important thing is that you use something and that you know how to use it. Okay? So there's different ones. There's ones for boys. There's ones for girls. There's ones for length for age, weight for length, and FOC. And so all of these 4 measurements come on one graph for children birth to 3 years. And there's one for girls and one for boys. In children from age 2 to 20 years, those same 4 things can be measured. And again, there's a one for girls and there's one for boys. So there's 4 different charts. One for girls, less than 3 years of age. One for girls, 2 to 20. One for boys, less than 3 years. And one for boys, 2 to 20. And you can plot all these 4 things on each one. I'll show you some examples of what the charts look like. So this is a sample of a boy, because it's blue. Boys are blue, pink for girls. And this is boys less than 36 months. We can plot on this graph, you can plot their length, and you simply take their length. You can do it in either inches or centimeters, and their weight in either pounds or kilograms. We tend to use centimeters and kilograms here. You find out how old they are, birth, 3 months, 6 months, 9 months, 12, and of course each individual line here is 1 month. So you can plot their exact age here in months with whatever they are. If they're 24 months and 11 kilos, that's right there. Okay? Anywhere between, and the CDC charts are different than the WHO charts and the Road to Health charts. The lines mean different things. On these charts, the CDC charts, this is anywhere between these two dark lines is normal. Anywhere between the two dark. So if you fall within these lines is normal. Okay? For a 1-point dot. Okay? This is 5th percentile, 10, 20, 50, 75, 90, and 95. Okay? If you're at the 5th percentile, well, you're still normal. You're low, but still normal. Okay? If you're at 50, that means you're average. If you're at 95, you're getting chubby, but you're still normal. Okay? And that's how you plot. It's best a 1 point in time is not the best use for these graphs. They're best measured over and over and over again. Because you can still fall within normal and be abnormal. If at 24 months you were, say, 13 kilos up here, and by 30 months you're still 13 kilos, well, you're starting to level off, and that may not be normal. If you ever cross two of these lines, that's abnormal. So you might still be gaining weight. Say at 9 months, say you're up here, you're at 10 kilos, but at 24 months, you're 11 kilos. Well, you've crossed two of these percentile lines. So that's still abnormal. They're gaining weight. It looks like if you just plotted one, it looks great. But they're not gaining weight enough. They're crossing percentile lines, and that's abnormal. Okay. These are just just so you can see, the girls are pink. This is girls. These are the other ones for boys. You can also do their height, and that's for these. The upper graph is for height, and that's for girls. Okay? So, weight growth velocity, and that's what we're measuring when we do serial measurements, less than 5% for more than 2 months. That's growth failure. If you have a child who falls under that 5 percentile range for 2 consecutive months, that's growth failure, that's malnutrition, that's at least stage 3, that child qualifies for ARVs, simply because they're not gaining weight. A loss of more than 5% or more of body weight, so they're losing weight in a child, that's growth failure. That's moderate malnutrition. That means it's stage 3 and the child qualifies for ARVs, simply because they're losing weight. Okay. So, according to the WHO staging, weight loss of greater than 10% in body weight without other associated symptoms, even in adults, that's stage 3. Stage 4, weight loss of greater than 10% plus either chronic diarrhea, weakness, or unexplained or prolonged fever. That's stage 4. So even adults who are losing weight with these other symptoms, that's stage 4 and would qualify for ARVs. This is what we're talking about. And this is a picture of a child who's malnourished. Okay, you can see the ribs sticking out, very thin arms, very thin fingers, wasting of the face. This child came to the hospital and was not tested for HIV. That child should not get to this stage without being tested for HIV. How many times did that child go to the clinic before they were hospitalized? Many times. Because he's had diarrhea over and over and over again. Why wasn't he tested? I don't know. Okay. This child was 10 years old and weighed 10 kilograms. He wasn't yet tested for HIV until he came to the hospital. You can see there's no muscle on here, there's no fat, it's just bone. Skin on bone, ribs sticking out. This is not an abnormal case. I could show you hundreds of pictures like this. Where would this child look on the graph? He's 10 kilos. He's 10 kilos and he's 10 years old. So we use the boys. He's a boy 2 to 20. That's where he would be on the graph. He's like in the writing. He's not even on the graph. Way, 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 way below 5%. What should he weigh? If he's just to make the 5%, to just be normal, well, he would be 25 kilos. that would put him at 5%. He's 15 kilos below that. So at 10 kilos, how old should he be? 1. A healthy weight for a 1-year-old child is 10 kilos. So this child at 10 years weighs what he should weigh at 1 year. Okay. So, does it matter what this child's CD4 count is? No. Would you even bother to draw it before starting him on ARVs? No. This child is stage 4. He needs ARVs and he needs them now, if he's going to survive. Okay. So this child should not have progressed this far before being diagnosed with HIV. This is one of our failures. He's been to the clinic over and over again with diarrhea, with pneumonia. If they were plotting him on his road to health card, they would have seen this long, 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 long ago. How long has this child been infected with HIV? For 10 years. Could you have probably picked it up in infancy? And would he have qualified for treatment in infancy? Yeah. Well, 10 years ago we wouldn't have had an ARV program, but if that child was born now, could have been picked up on his road to health card before he'd probably turned 2 years of old. Okay. So this is to show you, in a boy birth to 36 months, at 12 months, 10 kilos, that's still 25–50%. So this child was weighing, a good, nice, healthy weight for a 12-month-old child. So that's just looking at weight and looking at height. Now, as I said, there are blood tests that you can use to help determine nutritional status. A CBC, or FBC we call them here, to look for anemia. Well, anemia can be for many, 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 many reasons. But some of them are nutritional deficiencies. Okay? A macrocytic anemia, which means that there's big cells, means the MCV is large, usually over 100. That can be associated with B12 and folate deficiencies. A microcytic anemia, meaning the MCV is low, usually less than 75, is common with iron deficiency, which is very, very common in our population. So children with low MCV and anemia deserve some iron supplementation, because iron deficiency anemia is very, very common. Another thing you can use to assess their nutritional status is the albumin. Albumin is a great lab test to see what is the long-term nutritional status of a child. And you get that with your liver function test. You will get that answer. Alkaline phosphatase, calcium, BUN, phosphorus, they're all measures of how well a child is being nourished. So when you're HIV infected, you have high nutrient needs. You need more energy, which means more calories, more kilojoules. You need more protein. You need vitamins and mineral supplementation and fluids, often because of the losses in diarrhea, and often with pneumonias you lose more fluid. So what are some high energy things that we can use? As I said, when you're sick, you can need up to 150% of your normal needs. Well, when you're sick, you're not hungry. You're not wanting to eat. So how do you get those calories in? The best way is to use small, frequent, high-calorie meals. You can have people eat 6 times a day in small meals. They don't need a large meal 6 times a day, but small things very frequently. And things, carbohydrates, such as cereals and roots, banana, porridge, fortified with milk, things like that, are all very, very good. Sugar, adding sugar will help. Honey sweetens things, has lots of calories, and helps improve the taste. Very excellent things are dairy products, because they're soft, they're easy to use. If you have mouth sores, if you have thrush, you can still get it down pretty easy. You don't have to chew. So yogurt, milk, ice cream, they also are high in calorie, but they're also high in protein. So they're very, very, very beneficial. Fats are very, very high in calories, and so they're very beneficial. So adding oils, butter, margarine, avocados, and nuts are a great source of calories. So one way, a lot of children, you're not going to get them to drink a spoonful of oil. But you could simply sprinkle it, mix it in with porridge. They'd never taste anything different, and they get a lot of extra calories. The same thing, you can mix in butter, you can mix in oil, mix it into porridge. It actually improves the flavor, and it adds a lot of calories. So very, very important is high protein. You burn lots of protein, and you need lots of protein for normal growth. And this helps maintain the muscles. So what are good sources? Well, meats are excellent source, like chicken, meat, eggs, fish, very, very good. Beans, soybeans, peas, not a huge part of the diet around here, but those are very good source. Nuts, again, they're not a huge part of the diet, but something that's very easy and very easy to get children to eat and is very cheap is peanut butter. Peanut butter has lots of calories and lots of protein. You can mix it on bread, you can mix it in the porridge, or you can just have them take a spoonful of it. So peanut butter is a very, very, very good source of protein and calories and fat, all mixed together. There is a nutritional supplement, I don't know if the dietitians here have heard of it, called Subasisu, which is basically peanut butter with added vitamins in it. And it's ready-to-use feeding, RTFU, that the WHO recommends. And children can improve their malnutrition just adding this to their diet. Milk and dairy is very, very important. Whole, full cream milk, very high in calories and fat and protein. Same with cheeses and full cream yogurts. You can get children to eat. Not very many people in South Africa eat insects, but they are high in some parts. Mapani worms are quite popular. They're very high in protein, and I've tasted them. They don't taste very nice, though. So what about other vitamins? So a lot of nutritional deficiencies can occur. Most commonly your B complex vitamins like folate, vitamin A, C, and E, minerals like iron, zinc, and selenium. What should we do if we notice any of these deficiencies? Well, multivitamins usually contain most of these things. One thing that they don't contain is iron, so you might need to supplement them with iron tablets. And then fruits, vegetables, raw or partially cooked. If you boil vegetables, that often, so if you boil them and then get rid of the water, that gets rid of a lot of the water-soluble vitamins. So raw vegetables are actually better than cooked, than boiled vegetables. So vitamins A, C, and E, they're antioxidants. The needs are increased when you have infections. It's important for wound healing. Vitamin A particularly important for eyesight. The B vitamins, they're important for cell energy, for making red blood cells, so to prevent anemia. Those are very important, particularly thiamine and B12 and folate. So vitamin A deficiency, this is something that we do commonly see in children, mostly in the rural areas. So they're usually vitamin A gets depleted very quickly in times of illness, particularly in measles. That's why vitamin A campaigns are quite popular here. Every 6 months, mobile clinic nurses go out to many of the schools and give vitamin A doses, and this is why. And then this is just the dosing guidelines. You can look it up for your reference. What is vitamin A toxicity? Well, it usually causes problems with the eyes. It can cause scarring of the eyes, which can lead to blindness. It can cause these things called Bittose spots, which are like ulcers inside the eye that are painful, and it's where the lining of the eye starts to wear away. Okay, and you can see it can lead to a cataract, and so you can become blind, all from vitamin A deficiency. Okay. Your B complex vitamins like thiamine deficiency can lead to beriberi, which is a form of heart failure, simply from vitamin deficiency. also leads to neurologic problems. B3 deficiency leads to something called pellagra, which usually we remember it as the 3 Ds. It's dermatitis, which means skin inflammation and itchy, dry skin. Diarrhea, running stomach. Dementia, which means they're going crazy, and you can die from it. And here's a picture of a man with beriberi. It doesn't show very well there, but his skin is very, very dry. He's got cracked lips at the corners. That's angular cheilitis, very common with these B-complex deficiencies. And you can see here very, very dry skin, and that's the dermatitis associated with it. Anemia is very, very common in HIV-infected individuals. HIV-positive adults or children is very common. It can be really B12, folate, or iron, and low levels of any of these things can be contributing. One easy way to do this is with prenatal vitamins. Prenatal vitamins contain iron and folate. So if a child can swallow tablets, the same prenatal vitamins you use for pregnant women, you can give to children to help. And that has extra folate and iron in it. Okay. AZT, which we use mostly a second line here in South Africa, can cause anemia as well. Vitamin D deficiency can cause rickets, which is softening of the bones, particularly during development. I'll show you some pictures what that can occur. It mostly occurs in premature babies, but you can see it in children with vitamin D deficiency. It's not as common here because a very good source of vitamin D is sunlight. And so the children are outside playing very commonly here. So we don't see lots of vitamin D deficiency, but you can. What you see is this rickety rosary. I'll show you a picture of the ribs. It looks like a rosary beads on the chest, widening of the wrists and ankles, and short stature and craniotabes, which are these sort of bowed legs. This is a picture of rickety rosary. You see these lumps here. It looks like rosary beads on the child's ribs, and that's from rickets. There's micronutrient deficiencies like zinc, selenium, iron. Zinc helps the immune system. It's important in children with diarrhea. Zinc supplementation has been shown to help with diarrhea. It also helps in wound healing in children who have skin wounds. Selenium is important. You lose a lot during diarrhea. It's an antioxidant. Iron deficiency we talked a lot about. Very common in the pediatric population. Lots of them need iron supplementation, particularly in the first 6 months of ARVs. So early nutritional supplementation in HIV-infected children helps to preserve lean body mass, helps slow disease progression, should be encouraged to provide an extra meal or frequent small meals in children. And of course, they should be encouraged to use iodized salt to provide the necessary iodine. So supplements for children, all HIV-positive children should be on a multivitamin. Small children can take the multivitamin syrups. Older children can take the tablets. Vitamin A dose, according to the national guidelines, we give it every 6 months. And WHO also recommends iron supplementation for HIV-positive children because the iron deficiency anemia is so prevalent. For pregnant women, a study in Tanzania showed that just adding multivitamins improved some of the oral and GI side effects in HIV-positive women. It reduced fatigue, it reduced skin rashes, helped improve upper respiratory tract infections, and they progressed slowly to stage 4 disease. So women who also took multivitamins had higher CD4 counts and lower viral loads. So most clinics do provide HIV-positive patients with multivitamins, and this shows why it's very important. So most HIV-positive patients should be taking Bactrim, to prevent lung infections, and multivitamins have many, many, many benefits. Now, there are certain conditions which make it hard to eat, and so what would you recommend if they have these conditions? Well, the common things, oral, esophageal, and GI problems are very common. Oral sores, thrush, esophageal candidiasis, ulcers from herpes, from other viruses, from CMV, can make it very difficult and painful to eat. So we should recommend soft foods. Potatoes, avocados, pawpaw, banana, pumpkins, all these things can be mashed up and eaten, and they're very soft and pretty soothing if you're having sores. It's important to avoid spicy foods, avoid salty foods, because those are going to make it much more uncomfortable. People with lots of sores and difficulty chewing, they could drink through a straw, they could drink milkshakes, fortified milk, some of the Ensure shakes through a straw, and that makes things easier and easier to swallow. Cutting things into smaller pieces so you don't have to chew so much makes it easier. Sour milk is something else people like, makes it easy to drink and very high. We have to remember food safety, and we're going to talk about this during our opportunistic infection lecture, but it's very important to practice good personal hygiene. The fruit should all be washed very well with clean water. Meat should be cooked thoroughly. Meat, fish, eggs should all be cooked until they're well done. Eating raw meats, raw fish, raw eggs is not good really for anybody, particularly people with HIV, because their immune system is so damaged. You shouldn't mix raw and cooked foods, because the raw foods, particularly this is when you're preparing things. If you're having raw chicken on the same plate as your vegetables that you're not going to cook, that can contaminate things, and people can get sick that way. You should store and thaw foods at proper temperatures, and remember to use pasteurized milk. Unpasteurized milk has lots of different things in it that can make people with an impaired immune system, can make them pretty sick. Remember, breastfeeding women have increased caloric needs, so if they're breastfeeding, they need to take in more calories. Important things to monitor: bone density. Some of the medicines, tenofovir, which is going to be first line, has some problems with bone density in children and in adults. And look for refeeding syndrome. A child who's very, very, very malnourished, you can't simply give them lots of high-calorie food. They could actually die. You have to slowly increase the calories and nutrients that they take in. And based on certain guidelines, most of them should be hospitalized to do this, because they get very, very sick very quickly. Okay. So these are the things I'd like to end this lecture on. The last few slides are questions that I get that really drove why I wrote this lecture. Why I think people wanted a nutrition lecture. And these aren't in your slides, in your handout. But I'm going to ask you guys this. What diet can boost the immune system? What foods can people eat help to boost the immune system? Help me out. What do you tell your clients? What do you tell your patients? They come and ask and they say, I'm positive, I don't qualify for ARVs yet. I want to boost my immune system. What can I eat? Come on, tell me. Vegetables, I heard vegetables. So eat more vegetables, that boosts the immune system. What else?
Food that will provide your body with some energy, such as starch.
Yeah, so starches with lots of high calories, lots of things will provide you with more energy. What else? Protein, eating lots of protein. What's that?
Vitamins and minerals.
So taking vitamins like a multivitamin. What else? All right, everything you've told me is false. Nothing. So nothing boosts your immune system. If you're eating a healthy, proper diet, there's nothing that you can take in which is going to increase your CD4 count. There's nothing I can't tell you, eat garlic. Boost the immune system. Beetroot does not boost the immune system. Lemon juice does not boost the immune system. So what a lot of people take as one part of the equation doesn't match the other. So people with malnutrition, vitamin deficiencies, not taking in enough calories, not taking in enough protein, they do worse with HIV. Absolutely, that's true. That's what this whole lecture was about. But if you take in more, does that make it better? No. And that's what a lot of people are trying to enforce. That's what previous Minister of Health, the previous President of our country, said. Take in these things that are good for you and you'll do better. Well, that's not necessarily true. If you're malnourished, if you're starving, then yes, increasing calories, having a proper diet, getting you out of that condition will improve your HIV status. You will not progress as fast. But if you are already having a balanced diet, if you are not starving, if you are not malnourished, there's no diet that's going to boost your immune system. So, what about what our previous Minister of Health used to tout? Well, what I like to say about beetroot, garlic, and lemon juice, they all taste very nice. I like them all. I eat all of them. Garlic is delicious. I put it on lots of food. I like to put some lemon juice in some water. I like to eat beetroot salad. I love them. Does nothing for your immune system. Does not do anything for HIV. Nothing. 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 What people are doing when they're telling you this, just as we saw this slide a few times already, they're focusing right here. Clinical latency. There's going to be about a 7-year period where you're HIV positive and asymptomatic. Have no symptom whatsoever. 5-7 years can go on. So that's what people are focusing on. If you have a nice, proper diet, eat regularly, you're not starving, you're not malnourished, you're taking proper vitamins, you're not having nutritional deficiency, that's the normal. Eating more vitamins, things that are healthy and good for you, eating more of them, will that slow that down? No. But if you're malnourished, if you are starving, if you are having micronutrient deficiency, calorie deficiencies, it will speed that up. But you won't slow it down by taking extra vitamins. Okay. So the next one. What diet, what can you eat that can rid the body of toxins? This is all over the TV. Things you can buy. What can you purchase? What can you eat? What can you take? What supplements can I take? What vitamins can I take? Help rid the body of toxins. What foods can I eat rid the body of toxins? Help me out here. What?
What are the toxins?
Foods that I taught. Yeah, detox. The detox diet. What can I eat to detox? What helps? What's a good detox diet? I want a good detox diet. Water? Water's a good detoxer. Take water, flushes all the toxins out. What else? Exercise, get the heart rate up, flushes out the toxins. But you see commercials for these, all these things you can buy on TV that help detox. What are some of the names? T, yeah, there's the T1. There's the thing you can put on your feet, right? That help rid the body of the toxins. Ah, I like that. There is nothing. There's nothing that you eat. There's nothing that you drink. There's nothing that you can buy to rid the body of toxins. It's somebody's way of making money, and they're doing a very, very, very good job at it.
So water and exercise.
The liver and kidneys are two organs in your body that do it automatically. That's their job. They get rid of the toxins. There's no food, there's no diet, there's no supplement, there's nothing that you eat, drink, buy, anything that will get rid of the toxins. Well, water, you should drink plenty of water because that helps the kidneys to flush out the toxins. But then again, the important thing is, what are these toxins? What are you talking about? Where are they coming from? Well, the toxins, I don't really know what people talk about when they talk about toxins. Okay? Because the body has side effects, byproducts that it naturally gets rid of. Things that you take in may have pesticides on it. You don't absorb them in the body most of the time. If you do, your liver, your kidney gets rid of them. So these commercials, these people trying to sell things that tell you about all these toxins, one, I don't really know what they're talking about in toxins. And two, you already have something that does it. Your liver and your kidneys do it without you buying anything extra. Okay? A lot of people waste their money on these things. Okay? So, in conclusion, it's important that a healthy nutritional status is achieved and maintained early in the course of illness. Patients with HIV have increased nutritional needs with more nutritional challenges. If oral intake is adequate, supplement with vitamins and minerals. We talked about some of the things you can take if needed, if you're having problems. Okay. But there is no diet that will boost the immune system. If you eat too much wimpy, are you going to progress faster? No. If you eat KFC every night, will you progress HIV faster? No. Can it have impact on other things? Diabetes, heart disease, absolutely. But HIV, no.